an important aspect in or consideration in conducting the clinical trials as it pertains to ICH is not only the location of the intracranial hemorrhage, but rather concomitant therapies that may have precipitated the hemorrhage. What I'm speaking most commonly of, if the patient's on an anticoagulant or if they're on antiplatelet drugs, these can have a significant effect on obviously the approach to surgery. So patients who are on factor 10 inhibitors, have they been reversed? Patients who are on Coumadin or warfarin, have they been reversed? What are our potential options in patients who are on single antiplatelet therapy, or even dual antiplatelet therapy? These factors are incredibly important in recognizing, because they will not only have an effect into deciding who will go for evacuation and what needs to be done before ICH, but also perhaps whether or not it can be done at all. So reversal of patients who are on antithrombotic therapies, I think, will be an important consideration as we go forward for these trials, not only for the trials themselves, but also to realize clinical benefit. One of the big considerations for us as surgeons is to make sure that we are selecting or having the opportunity to, if the patient has an iatrogenic coagulopathy, i.e. they're on a factor 10 inhibitor, they're on a thrombin inhibitor, they're on Coumadin or warfarin, that we have the opportunity to reverse these therapies. And another thing that is coming up, one of the things that we deal with is Clopidogrel or Plavix is a P2Y12 inhibitor that many patients are on right now. And that's an irreversible drug. Whereas right now there is Ticagrelor or Brilinta. There's a company called PhaseBio that is developing a reversal agent for this P2Y12 inhibitor. And should that phase 3 clinical trial readout as positive, I think will have a significant impact on how we as physicians prescribe those drugs, because ultimately, if we have a patient that needs to be on a P2Y12 inhibitor, given the risk, even a small risk of intracranial hemorrhage, the opportunity to have a reversal agent on board so that we can actually intervene on these patients, or even if you can imagine the patient that has a hemorrhage that doesn't need intervention now because it's not large enough, the opportunity to reverse that effect of that antiplatelet drug will also be of paramount importance.